Assalamu alaikum everybody, my name is Zohra Khaku and I'm the director of the Muslim Youth Helpline. Just a quick note on who we are and what we do. We are a national helpline. We've been dealing with calls about the coronavirus for the last few weeks, lots of different issues. So we've created a bit of a resource page, myh.org.uk/coronavirus. I'll tell you a little bit more about the partnerships we've created around helping people through their mental health around this time later on. But just a quick thing of what people have been calling about. This list sort of gets a bit longer and longer every week, unfortunately, but these are just some of the things that people call about. I'm going to go straight through to bereavement because that's really what we're talking about today. So the biggest thing that we've been dealing with is a loss of support systems. We need to adapt to make sure that the support systems that we currently have or have relied on in the past still work for us, or that we can adapt to have new things that work. So we've just been hearing about things like live streaming funerals and things like that. But I just really wanted to focus on some feelings and emotions and how we might deal with those. So on the screen there you see just a few things that people have been talking about not being able to, and not having the choice to be somewhere when your loved one passes away, not being able to be at a funeral, and then also not being able to mourn in the way that we usually mourn. So generally people would be going over to people's homes after somebody in their family passes away, and we're not able to do that. People might even be in quarantine, so they may not even be able to see their own family members, which is really tough. And the last thing I wanted to mention on this is that we're all going through this kind of trauma. Everybody will know somebody who died. For those of us who saw the pictures even of 13-year-old's funeral yesterday and the day before, I think it affects all of us. So even though you may not know somebody personally in your family who's died, we're still all affected by the trauma of all of this that's going on. And it's important to recognize that. Feel sometimes like we're drowning, and I think really what we need to do is try and find some light in this moment. So I just want to talk about those feelings and emotions. It's hopelessness, that you feel like you can't do anything. There's anxiety, worrying about all of these things that are going on in the world and how you fit in. The internal environment has changed because we're all at home, and the external environment has changed almost unrecognizably because everything is different in the world. So your usual coping mechanisms just aren't things that you can rely on anymore. We've been hearing a lot about guilt, things like not being able to be there when someone is dying or when somebody is sick. And that counts for even when you're in a family where somebody's in quarantine. Even not being able to give someone a hug when they're feeling low or feeling sick is really hard. Isolation and loneliness kind of go hand in hand. And the last emotion we've been seeing is anger. So sometimes people have sort of misdirected anger, and sometimes it's anger that just at the situation that they're in. But the point is, all of these emotions and feelings are valid. They're all things that you feel. It's not like we can say, oh, well, we can just stop feeling hopeless and stop feeling anger. We need to feel these emotions and these feelings. It's really important to remember that it's okay not to be okay. This is not something any of us could have prepared for. And the way that we're mourning and the way that we're experiencing these losses in our communities and in our families is not the way that we have had to endure at all before. So it's okay to say, actually, I don't know how the heck I'm supposed to get through this. I don't know how I'm supposed to support somebody who's going through this. It's something new, and it's important to remember that. The next thing I wanted to talk about is that we put a lot of emphasis on religion and God and mourning. And because our usual ways of mourning aren't there anymore, we need to think about that kind of expectation that you can go back to some sort of normal life. Because even though you're going back to life after experiencing some sort of loss or grief, you're not really going back to whatever life you had before. It's a completely different time. So religion's given us the guidelines to deal with it. We have a sort of communal way of mourning, but sometimes we don't really think through or allow ourselves to feel that emotion. So for example, if you've lost a father, are you still a daughter? What's your role? It changes. And it's important to remember that the prophet cried, that the prophet mourned. There's no shame in seeking help. The prophetic tradition is actually to feel those emotions and to let that out and to be kind to yourself. And we really need to remember that in these times. It's easy sometimes for us traditionally, I suppose, to just say, well, I'll get through this on my own. I'll deal with this in my room. But actually the prophetic tradition is to experience that loss. It's really, really important. So in terms of expressing emotions, just a few things, ideas of where you can start. Counseling. And with counselling, it's difficult at the moment, of course, because we don't have face-to-face sessions anymore. But if you don't know where to start with that, just contact MYH. We're really happy to refer you to professional counsellors, bereavement counsellors, anything that you need. Online and social media has become a bit of a, I was going to say haven, but really it's probably not a haven. It's probably a coping mechanism for all of us in terms of being able to express your anger, express your emotion, your upset. Social media is social, that's the point of it. Posting things up on Facebook, on Instagram, wherever you are, is worth doing if you feel like sharing. Writing is something that's, I suppose people are starting to do this a little bit more at the moment because they're in isolation and can't really go out and talk to their friends, but writing is important. Talking to whoever you can, whether it's your friends on social media or on Zoom or whatever it is. And the last two things, knowing where to go is one thing. So at the point at which you feel, actually, I can't handle this, I don't know what to do, all you need to know is one place to go to. So again, MYH is a good place for that because we're really happy to refer you on to where you need. Helplines are really in their element at this moment in time and very busy, rightly so, because at the point at which you feel like you have no hope, somewhere like the Samaritans or MYH are a very good place to start. And the last thing there, in terms of expressing emotions, is actually crying. There are points at which we are all going to feel like it's just overwhelming and you just need to let it out. And that's a really important thing to allow yourself to do. Let that happen. In terms of signposting, I just wanted to put up two particularly relevant resources. One is the Macmillan support line. So for those of you who don't know Macmillan very well, Macmillan, although they handle a lot of cancer care, they do a lot of end-of-life care and loss and mourning and bereavement. So the way their support line works is you call them, there's a helpline worker who can help you through emotions, but they can also refer you to telephone counselling, professional bereavement counselling for free on the phone. So that's really, really useful. And the second resource there is the Macmillan Community Forum, and that's where you can go online any time of the day or night and speak to other people who are going through loss and mourning. So it's a really important place that you can go to for support. Just to kind of finish off, just to let you know, in terms of mental health and all of these things, there are a few organizations that particularly work on mental health from a faith and culturally sensitive perspective. So all of us that you can see online there on the screen are working towards making sure people have the resources that they need. Please feel free to get in touch with any of us if you need anything. And lastly, just to put up there, just to remind you, myh.org.uk/coronavirus, we're putting up as many resources as we can from other organizations and also from ourselves around mental health and bereavement and loss, and really just trying to get through the trauma and coping through all the things that we're going through at the moment. That's it. Thank you.
Zohra, thank you so much. Could you clarify whether MYH is a helpline that's only for those under the age of 18 or whether it's open to anyone?
Sure, thank you for asking that as well. So we're called the Muslim Youth Helpline because we focus on trying to get youth to open up to us, but really it doesn't matter how old you are, you can get in touch with us. I think our oldest ever caller has been in their 70s and it's absolutely fine. We're still there to provide faith and culturally sensitive counselling support to anyone who needs it. So you don't need to be under 18 at all. Any age is fine, and any issue. The main thing to know is that our support is completely non-judgmental. So whatever's going on in your life, and confidential, whatever's going on in your life, please feel free to call. The only other language we provide is Gujarati on the phone. But if you need counselling or support in different languages, we're really happy to signpost you to other services who can do that.
Thank you so much. I think as Brother Wajid has mentioned in the chat facility, there are lots of other mental health organisations in the Muslim community also providing support and working with Muslim Youth Helpline and other organisations to best support Muslim communities at this time.